I'm Dr. Austine Mengnjo. Um, I was trained in Cameroon, attended medical school from 1993 through 2000. After graduation, I spent about 2.5 years practicing in Cameroon in one of the major hospitals and in one of the major cities in Cameroon, which was Yaoundé and the Yaoundé Central Hospital. And while I was practicing as a junior physician, uh, I got to see a lot happen to our patients and the people I took care of. And one particular thing that stood out was, uh, the lack of subspecialty care. I remember being in a general medical ward and the only kidney specialist or nephrologist that was there got handicapped by a medical issue, and it was actually a stroke. And so he was incapacitated. He couldn't talk, he couldn't walk, so couldn't come into the hospital, couldn't take care of his patients. And despite this hospital being one of the biggest hospitals in the city, I saw a group of patients die because nobody could provide the kidney care that they needed. Patients who had either acute kidney failure and failed to recover, those who had chronic kidney disease, those who progressed to requiring dialysis, those who couldn't travel out of the hospital and go to other cities or other hospitals literally died there while waiting for a new nephrologist to come along. And as a physician, you are charged with taking care of people and helping them, and it's very painful to watch them, succumb to diseases that nobody has, a clue as to which direction to go and what to offer them. So, I mean, and there are lots of other personal stories because some of my friends and family members also got affected. And so that was my driving force. And once I left Cameroon and traveled abroad and wanted to pursue a subspecialty, nephrology was at the top of my list because my objective was, if I even end up taking care of a patient with a kidney problem in some other part of the world, is actually, indirectly paying back or trying to fill that void. And that particular, those particular patients that literally traumatized me. So, and that's why I ended up, pursuing a fellowship in nephrology after my residency in internal medicine. And since then, after graduation from fellowship, I've been a practicing nephrologist in the semi-private and academic program. And along the way, I became an associate professor of medicine in Drexel University College of Medicine, located in Philadelphia, Pennsylvania, in the US. So I've been practicing nephrology for over 10 years now. And looking back and where I am right now and where I started, it's an immense pleasure for me to continue to provide this service to our patients, the population of which is growing, not only here, but also in Africa. And my hope is one day to be able to, go back and or collaborate to help those who are back there who may not have this service readily available to them. So that is the summary of my journey in medicine so far. And I am very excited to be part of this initiative because what I've learned along the way, I think needs to be brought back home. What I found there and what I know, having and having been talking to my colleagues who are still back there, I think there is a huge gap in knowledge and getting acquainted with the latest in various fields of medicine.
Why is CME CPD important?
Well, in order to just to explain my own perspective and why it is important, I want to make it a little bit personal. First and foremost, we doctors, we are not superhumans. We are not semi-gods. We are as human as our patients. We eat the same food, drive the same cars, live in the same environment. And so we are exposed and affected by the same genetic, environmental, metabolic, and other diseases like our patients. And sometimes you say, well, if I fall sick one day, who is that type of doctor I want to take care of me? Because as humans, we are all going to fall sick. We also get medical conditions as we age, whether we are younger or older. And then when it is your spouse or your children or your parents or some other close family members, when they fall sick, what type of doctor do you want to take care of them? Someone who is well updated about the latest guidelines, or someone who has been practicing medicine the same way 10 to 30 years after graduating medical school or a subspecialty training? And again, a good hospital or clinic is not about its walls or the beauty of its architecture. It is about the quality of the medical care that is delivered. And doctors are at the forefront. And you won't deliver quality medical care if you are not updated about the latest practices, because medicine is not a static science. It is an evolving science. And new things are coming up. And as physicians practicing in Africa or back home, we want to give them the same quality of care that is available to other patients all over the world. And most of our patients are not as rich as our government officials who readily get evacuated abroad when they fall sick. And it is up to us. It is on our shoulders. We cannot continue to wait for the government to do it for us. And a knowledgeable physician is a very confident and happy physician. No matter how many hours you put into your work every single day, when you know and you are comfortable and you are updated on the latest practices and you deliver the best quality care that you can, you are a very happy and fulfilled physician. So that's where the issue of CME comes in. You cannot deliver this type of care, which you expect to be delivered to you and your family, if they are not familiar with the latest information that's out there, the latest treatments, the latest diagnostic strategies, irrespective of your subspecialty. So it is critical that we bring this service to Africa. Now, in my experience in practicing in the West is that every 2 years, you are required to renew your medical license, and you are not allowed to renew it if you don't fulfill CME criteria. CME. So irrespective of your seniority or how many years or your expertise you've been practicing medicine, you are required to fulfill and CME criteria in order to renew your license. And that's every 2 years. And that's about 100 hours of CME in the US, for example. And then every 10 years, you are required to take a recertification exam, meaning if you were a qualified nephrologist after practicing for 10 years, you are required to go back again, sit for an exam to make sure you are updated with the latest practices in nephrology. Whether you're a cardiologist, it's the same. Subspecialty or general medicine, it is the same. So this is what is happening here. And that's why we have the quality of care that exists here. Like I said, the hospital is not a physical wall. It's not the beauty of the architecture. It is the competence of those providing that care. And the doctors are the leaders of this pack, and there's a trickle-down effect. You know, the doctor is competent, it's going to trickle down to the nurses and to other ancillary staff. So if we have to compete, help, and improve quality of care in Africa, that's what we should be doing. And it's long overdue. We cannot continue to wait for the government that's preoccupied with other things. It's on us. And another perspective to this is that I've talked to a lot of my colleagues that are practicing, that we are trained on the continent and now happen to be practicing abroad. And everybody expects to go back home someday. Some people want to go back either for short visits or permanent or semi-permanent. And the same question keeps coming up. If I fall sick while in Africa, who do I expect to take care of me? Where should I be going? So you can see how much just the fact that we may not trust the quality of the care that's delivered on the continent, that people are hesitant to make this decision and go back and contribute to the healthcare in their respective countries. And I bet you the African doctors are some of the brightest that Africa can produce. The brightest students actually go to medical school. So these are very competent individuals. They just need the material, they just need the resources to make them even better.
It's not only doctors that benefit. I guess the bottom line is the patients.
Yes.
So that CME, CPD is the connector between a competent doctor and a healthy patient, or a patient that comes out of a situation as best they can. Would I be correct in that assumption?
Absolutely. Because, well, like I said, medicine is evolving. Medicine is not static. So there are updated guidelines on managing certain conditions. The way we were taught in medical school, that has changed. And if your knowledge is still just what you learned in medical school or what you learned during your subspecialty practice, it means it is rusty. It needs to be oiled. It needs some oiling. It's like driving a car. If you don't take it to a body shop, it's going to break down. So your knowledge, maybe, you have the base, but you need to be updated. And because new things, for example, in managing diabetic kidney disease, well, a lot has changed in the last 5 years. And imagine that you are in Africa and you are still stuck with what you knew 5 years ago. You don't know what the latest guidelines are, meaning our patients are not receiving the best care that has been proven by studies to prolong life, delay progression, and it has a ripple effect. And it could be your own family member. It could be you tomorrow. Like I said, what do you want for yourself? What you want for yourself is what you should deliver to others. Good quality medical care. And it depends a lot on getting updated on what are the current treatment guidelines. And you won't do that without continuous medical education, or CME. Unfortunately, you can't wait for someone else to dictate to you. You have to do it yourself.
Absolutely, well said. And I know that CME is one thing, and actually engaging in CME is another. A number of healthcare professionals I've spoken to in Africa who tell me that access to CME is a challenge. Now, I know you've practiced at least you started your medical career in Cameroon. Are there colleagues that you have back in Cameroon who tell you that this access to CME is still a challenge? Because, while we want them to do it, are they able to?
Exactly. And access to this CME material, unfortunately, is a problem and continues to be a problem on the continent. Why? Well, first and foremost, there's no authority that requires any practicing physician to complete some CME time in order to continue to practice medicine. That's one thing. So there's no regulation, there's no enforcement. So it's up to each individual physician who wants to get better to look for the material themselves. And unfortunately, this entails some out-of-pocket cost. And most of the physicians, they are so busy practicing their art that they create very little time to dedicate to continuous medical education. And then even when they do, is where do we go for these resources? What is it that has been done that is out there that's tailored towards Africa, tailored towards the way to our own population that has its own particularities, So it is knowing where to go to access this material. It may be there, but if you don't know where to search, even with your best intentions, you may not access it. So not only is the cost, not only the lack of regulation, but also where to go to access this material. So an initiative like the Milho is highly, highly recommended, and it is because it attempts to bridge that gap. And it's something that every physician on the continent needs to be able to do and access and be sensitized about where to go get it. So that's the main thing with those who are on the continent and those who are outside, is being able to access the resources that are available to help them improve the quality of the healthcare delivery back in Africa.
Absolutely. I completely agree with you there. And I know that we started off talking about some of the work that you have done in supporting not only the colleagues that you have back in Cameroon, but also the patients that they take care of through the telemedicine. I know that you shared that with me at some point, and I was fascinated. I wonder whether you can speak to that in terms of, how you actually do that.
Yeah. So again, this is another tool that physicians. It was it just came along, and I think telemedicine took off after the COVID pandemic. We realized how what a great tool it was to be able to deliver healthcare without being physically present. And for those practicing medicine on the continent, it is a way of actually getting subspecialty care without a subspecialist physically present. I wish when I was in the Central Hospital in Yaoundé in those days, I had access to a telemedicine nephrologist anywhere in the world, someone who could just tell me, well, for this particular patient, do this, do that, give me feedback, let's work together to improve and save these patients' lives. So that is now readily available. And for those colleagues that are willing, it is a very, very great tool. We work as a team. They say when you have several heads together trying to solve a problem, you are more likely to succeed than one person doing it all alone. And because there are things you may underlook or overlook, but overall is delivering good quality care to our patients. So I've had, a lot of colleagues reach out to me with difficult medical situations to handle. And, then we work together and, bounce ideas over each other, and the way forward, get the treatment plan, and then look at the patient's response, and so on and so forth. So I have been able to actually, help a lot of patients who were almost on dialysis end up recovering and going home, and they have saved themselves and their families a ton. But the physicians have to be able to reach out. They have right now, prior to this time, there was a difficulty in connecting with those physicians practicing in the diaspora in other area in other countries outside Africa. But now with social media, you can now have a face-to-face discussion with a colleague back home in any corner of Africa over a case that he may be seeing and handling. So that has helped a lot, and I hope this area of medicine is also exploited for the benefit of our people.
Yes, that's truly inspiring, and anything is possible when you really put your mind to it. And I'm sure that telemedicine is an area that has grown because offshoot of COVID, and if we can take advantage of that, those practicing in Africa, if they can take advantage of that, connecting with people like yourself and all the other specialists, then that's, as you say, it's a great tool for us to move forward in terms of our healthcare. And I know you touched on some of the challenges, including being physical location, time, and cost. Now, is an online platform, in your opinion, a good way to overcome some of these challenges, so that CME, CPD are now available as an online opportunity in order to increase access?
Absolutely. That's why the Mengnjo initiative is very, very important and comes at the right time, because, well, you don't have to travel to a physical location. You don't have to, it's brought the CME right to every physician's doorsteps. You don't need to create. All you need is choose an hour a day time. You are not obligated. You are not traveling to a physical location. All you need is your own effort. It is right there. And the internet connection is now has reached every single corner of Africa. So there is no excuse any longer, because once you are aware of this resource, then it has been brought right to your doorsteps and into your bedroom, because you can do it anytime, any hour, So this is something that all practicing physicians on the continent need to be aware of. We need to, spread the message far and wide and bring this great tool to our people back home.
Oh, that's great. I appreciate those comments. And I know you were the subject matter expert, reviewer on some of those courses. I'd like to hear from you. What do you think stood out as far as the content of the courses that Mengnjo Initiative curates?
So, well, one thing that I'm happy to have been part of this team, and I was so excited because, sometimes you may, as a physician, like I said, with my experiences on the continent and coming over here, was how do we bridge the knowledge gap? How can I bring what I know now back to my patients? How can we get this to those who are still practicing on the continent, taking care of our families, our family members and friends, So this, and I had the opportunity of reviewing this case, and a lot of the topics and subjects matter that the Mengnjo Initiative had produced. So it is the dedication, the hard work, going to look for the resources, the materials, search the literature, put it together, and bounce it around. That is a level of dedication that you hardly see. And that was, I feel so happy being part of this team and having to help bring this knowledge back home and to bridge the gap, the knowledge gap between those who are my colleagues that are practicing back home and those that are abroad. So it is a great initiative, and I'm very, very happy to be part of it. And again, when you do it, you also learn along the way. So, we never stop learning. And, when you look at the material, as you review it, you even educate yourself the more. So it is very exciting. And I know physicians are people who love to new knowledge, get challenges. And I think this is going to help them a lot. All we need is sensitization. Let this spread the word far and wide.
Oh, thank you. And I really appreciate the input and guidance that you gave when we were developing some of those courses, the acute kidney injury being one of them, stroke being the other. And I think with your input, it really made a difference because, as you say, we have to develop content that is relevant to the African population. A disease is a disease, but the way it manifests and some of the causes behind those diseases are slightly different. Even genetics come into play. So, thank you for, your guidance on those. We're looking to bring other experts like yourself to do other courses that we're planning. What would you say is your experience working with the Milo Initiative team?
Well, I've had a very, very excellent experience working with this team. And like I said before, it is something that I had wished for personally, but didn't even know how to go about it. So when I met you, and I'm so grateful, Helen, for you taking up this challenge and trying to bring this to our continent, I was very, very excited. And that's why I readily reviewed some of the material. And I hope that those who will be benefiting from us can give us feedback, because the work continues and we want to make this better. We want to help our continent, help our doctors, help our patients by bridging the gap in knowledge and continuous medical education. So it was, a very, very wonderful experience working with this team. And I hope that we continue to work together. And I'm looking forward to more challenging topics that are relevant to healthcare delivery in Africa.
Absolutely. I agree with you 100%. And thank you again for your support. And I hope that support will continue. And as you rightly said, we are looking for, feedback. We are not perfect. I myself, I'm not a physician, so I rely on people like, the experts like you. So, together we can definitely make an impact, or at least make a small difference in the world, because that's what the Milo team is hoping to achieve. I think with that said, that is really all the questions that I have for you. Last but not least is, would you recommend those courses to your colleagues in Africa?
Absolutely, 100%, because this is what we've been waiting for. And like I said earlier, we cannot wait for the government to do it for us. If we want the quality of the care, if we want to give our best to our patients and our population, this is what we all need to do. Every single physician that is practicing on the continent should be updated on the latest guidelines in whatever part of the continent. So these courses are highly recommended to every single physician, young and old, practicing on the continent.